Dr. Ken Landau. Let's talk about Belsomra. Belsomra is a sleeping pill, a new sleeping pill that you see advertised all the time on the television, and you see the ads for it in the magazines. Belsomra is a drug known as Orexin that was approved by the Food and Drug Administration just in August of 2014. It's made by a large manufacturing company, a pharmaceutical company called Merck. And Merck proudly announced the drug as the first in a new class of sleeping pills. Belsomra, you see, helps reduce wakefulness. It reduces wakefulness by interfering with the action of a chemical that keeps your brain awake, known as Orexin. It acts differently than the standard sleeping pills that actually boost sleepiness. Now, we know that insomnia, or lack of sleep, is a potential problem. We know that it can lead to anxiety, it can lead to a lack of energy, it can lead to daytime sleepiness and depression, can lead to irritability and trouble, certainly, with your memory and with your ability to learn. Well, the American Academy of Sleep Medicine says about 30% of us are going to, at least at some point in time, suffer from insomnia. And in about 10% of us, it's going to be bad enough so that it's going to interfere with our daytime activities. So the idea of a sleeping pill is to put you to sleep more quickly and keep you asleep for a longer period of time. Well, if you're going to take Belsomra, you should allow at least 7 hours when you don't have to be fully alert. So you have to stay at home for that period of time after you take the pill. And you should take the pill within about 30 minutes of going to bed. You can take it with food or without food, but if you take it with food, it's going to be a little bit more slowly absorbed, and it'll take a longer period of time to work. Now, how well do sleeping pills work? And the answer is overall not very well, in spite of the fact that we all think that they're very helpful. They only give us a little bit extra sleep. They get us to fall asleep more quickly by about 2 or 3 or 4 minutes, maybe up to about 20 minutes more quickly than normal. They're associated with some side effects, so they can make us sleepy during the course of the day. They can interfere with clear thinking. They can impair our driving. You certainly should never take a sleeping pill like Belsomra and then have alcohol at the same time. And if you take the pill, it might cause a problem with sleepwalking or a peculiar problem that we call sleep paralysis, where you have difficulty moving or talking, either transitioning into sleep or transitioning out of sleep. You have some peculiar behaviors where you can get up at night and prepare food or make phone calls. And then a small number of people have suicidal ideations taking sleeping pills. We also know that they can interfere with other drugs. So if you're going to take Belsomra, you should not take ketoconazole, you should not take Biaxin, you should not take a variety of HIV medicines. And if you're going to take the Belsomra, you should reduce the dose from the 10 milligrams that's recommended to 5 milligrams if you're taking Cipro, the antibiotic, or diltiazem, or erythromycin, or fluconazole, or if you're even drinking some grapefruit juice. And we know the side effects are increased in people who are obese and in women. The side effect increase, well, it causes more headaches, more abdominal distress, more dry mouth, and more cough. Well, originally in 2013, Merck tried to get the Food and Drug Administration to approve a 30 or a 40 milligram pill. But after looking at the evidence, the FDA had a lot of concerns, especially with the hangover the next day and your ability to drive safely. Well, according to Dr. Joseph Herring, who presented evidence to the Food and Drug Administration Advisory Committee, he was the executive director of clinical research, he said that the 10 milligram pill was not all that much different than a placebo, and evidently the 5 milligram pill wasn't even studied. Well, guess what? The approval that Merck got was for the 10 milligram pill. Remember, the pill that the executive director of clinical research says doesn't work all that much differently than a placebo. And at the present time, the maximum you're allowed to take is 20 milligrams, comes in 5 milligram, 10 milligram, 15 milligram, and 20 milligram. Well, because the pill is causing such a stir, Consumers Reports actually commissioned a study from doctors at Dartmouth. Their evaluation says basically that you should skip the pill. It's too expensive, it barely helps, and it has some safety concerns. They evaluated the 15 and the 20 milligram pill, and what they found was that you fell asleep only about 6 minutes faster taking the pill, and remember, that's a relatively high dose, so that's as good as it gets, and you stayed asleep for only about 16 minutes more. And as a matter of fact, you don't awaken refreshed. You actually awaken and you're more drowsy. You have more problem with driving accidents, motor vehicle accidents, you get more tickets, and there's the possibility of hallucinations. And as a matter of fact, we have a problem with price. Anytime you see a drug advertised a lot on the television, you can tell it's going to be expensive. So how much is Belsomra? It's about $10 a pill. $10 a pill, $300 about a month. Well, if you take one of the generic sleeping pills, generic Ambien, generic Restoril, they cost about $10 for the entire month, not $10 a pill, but $10 for the month. And if you take Lunesta, that's now available generically, well, you can take that for about $20 a month. Well, is there any evidence that Belsomra works any better than the less expensive sleeping pills? And the answer to that is no. Well, now the other question is, why is it advertised so much? Well, sleeping pills are big business. Just Ambien and Lunesta alone, in their peak, sold more than $3 billion a year. Now they're off status, so you can buy them generically, and the amount of money spent on sleeping pills has fallen from 2013, a little more than $2 billion, to now estimated 2016, only about $1.4 billion. And as a matter of fact, the American Geriatric Society, they say you have to be very careful of these pills, especially if you happen to be a senior. They may cause problems. So what's the bottom line? The bottom line is you ought to do everything that's appropriate so that you don't need a sleeping pill, but if you do need a sleeping pill, go take one of the cheaper alternatives. Works every bit as good, and save your pocketbook. Anyway, thanks for watching. I'm Dr. Ken Landau.